There we are. Hello, everybody. Welcome. Thank you for being here. We're so glad to have you here. Just waiting a minute to seeing as all of us are joining in. Thank you for taking the time out of your day to join us. It's very exciting. As you're coming in, take a second to pop in the chat how you found out about today's masterclass. Know that this masterclass will be using the chatbot quite a bit, so it's interactive. I'll be asking you some questions or trying to get your reactions throughout. So if you have a sec, take a minute in the chat to tell us how you found out about us. Thank you. Thanks, Erica. Hi, Krista. Hello, Heather. All right. Okay, without further ado, let's get into this. This is a live interactive masterclass put on by Zenmen Health. My name is Kelsey. I'm the Chief Operating Strategist. Just so you know that you found the right Zoom room, so you're not lost in the halls of Zoom, today's topic is Lyme disease decoded, from tick bite to chronic complications. We decided to put this together in recognition and honor of Lyme Awareness Month, which is happening now during the month of May. We have a full session packed with science-backed info on Lyme disease and tick-borne infections, the what and how from initial tick bite to dealing with vague and maybe chronic symptoms that point to Lyme disease. You don't want to miss out, so let's stick around, stay tuned. If you happen to have your sound down, just simply put yourself on mute. You don't have to turn on your camera today. We will stick around to the end. We will have a live Q&A session where you can ask our guest speaker, Dr. Cory, our surprise guest speaker, Heather, which some of you already know about. We'll have a Q&A session for them towards the end of the session. So do stick around and listen up. All right. So before we dive into the meat of our presentation, I wanted to highlight our promise to you during our talk this evening. We're here to help you understand why misdiagnoses and inconclusive testing are so common in the US today. Our goal this session is to help you gain insights into effective next steps in treatment, whether you're new to the topic or even if you've tried everything. And because we have expert guest speakers, you will learn what else may be going on in your body beyond Lyme. We promise to you that this is a science-based, actionable training. And I wouldn't be a good moderator if I didn't go over some house rules. We're not here to give you a magic bullet solution, so if you're looking for a gimmick or a quick fix, then this is not the session for you. In order to be successful in the long term, you'll need a strong sense of honesty, integrity with yourself to allow the information presented today to sink in. Be ready to dig in and do the necessary work. We can show you the way, but you can do it. We cannot do it for you. Are you ready to participate and have a little fun? Type yes in the chat if you're ready to get started. There we go. Heather is ready. Anyone else ready? There we go. Thank you, Krista. We're waking up. It's Friday night, everybody. Yes, I love the excitement. Thank you. Remember, all the information provided here should not be used as medical advice, and you're strongly encouraged to consult with your healthcare provider before trying any methods described today. So, without further ado, I'm genuinely honored to introduce our guest speaker, Dr. Cory Tichauer, who is the Chief Scientific Officer at Zenmen Health. He is a leading naturopathic doctor with deep expertise in tick-borne illnesses, including Lyme disease. After earning his degree from Cornell University, Dr. Cory chose a more holistic path, focusing on naturopathic, patient-centered care over conventional approaches. He now serves on the board of the International Lyme and Associated Disease Society and is widely recognized for his work with complex chronic Lyme cases. Today, he'll shed light on why Lyme is becoming more complicated, how our environment plays a role, and the real struggles patients face in today's medical system. Welcome, Cory.
Hi guys, I'm really excited to be here with you all. As Kelsey mentioned, I am in my 22nd year of practice. I started with a goal of initially trying to work with and help the chronically ill population. And it didn't take very long after beginning medical practice to realize that chronic infectious illness, like tick-borne illnesses, are a underlying driver for a lot of people suffering with chronic inflammatory illness and degenerative conditions, as well as this whole array of functional issues from like fatigue and joint pain and things that a lot of people are familiar with, but that the traditional medical system has really very little to offer other than symptom relief. So, like I said, it's an honor to be here with you guys to share some of what I've gathered over these past few decades in working full-time treating patients with tick-borne illnesses. So without further ado, let's
Thank
get into
you.
things.
Yes, please. All right. So I have a handy map for you. It might be a little overwhelming, and there's two Americas, as if one wasn't enough. Will you explain what's going on this slide for us, Cory?
Yeah, so this is actually really an interesting introduction to this whole topic because it highlights the division of awareness that exists between what you might think of as conventional or CDC-based recognition of Lyme and compared to the experience that we're seeing out in the medical field and with people suffering with these conditions. On the left side, you'll see the CDC map. That's actually the 2023 map. And it's interesting because it really hasn't changed much over the last 2 decades. It still shows a concentration in New England and the area of Wisconsin, Michigan, those states around the Great Lakes. And a lot of this has to do with the criteria for reporting. You'll see that it goes from a test, the testing, there are certain recognized tests, and we'll get into that in a little bit. But those recognized tests go to the county once they're positive, if they meet those criteria, and then the county actually decides whether they're going to report that to the state or not, which then has to report to the federal government. But what we're seeing with this is a lot of disawareness amongst healthcare providers. In the areas of dark blue, we know that providers are more aware of ticks as a concern, and so people who end up getting like symptoms like flu-like illnesses, things like that after they've been outdoors, those providers are more likely to test. Whereas if you live in other areas of the country, like the West Coast is an example where we still see a lot, or along the Rocky Chains, or really anywhere, a lot of providers just don't actually think of testing for Lyme, or they're very dismissive of it. And that brings into account the second map on the right, the Google Analytics map. The Google Analytics map is really interesting because it's really representing the testing, the reported positive results from testing facilities. And that's not just standard two-tiered tests, which again, I'll get into in a little bit here, but it can include direct molecular tests like immunofluorescence or PCR, things that also will be recognized. You can see that there's some odd little natures to that. You'll see a little red spot in certain areas, and that really highlights again like population density or the county's decision to report or not. But the key that you'll see underneath that map is based on, as you see, percentage change. And I think it's really interesting to note that if you compare it to the CDC map, you'll see that in New England and along those Great Lakes areas, we're not seeing huge shifts in the increased percentages. It is increasing for the most part, and a lot of that can be due to a whole host of factors, from migration of the tick host to global warming and other things. But what you'll see is the pinks are in like Arizona and Oregon and Washington and the Midwest. And what it's actually showing is that there is increased awareness. There is mostly amongst patients, people asking to be tested, and those people are testing positive. And so you're starting to see the disparity between what we're actually hearing from the CDC on the left and what we're actually seeing as positive results from the labs themselves. And this ultimately, like I said, highlights that tick-borne illnesses are actually a national issue, and they're in virtually every state at this point. So it's, where you live, you're not immune to potentially getting these infections.
Yeah, no, it's really insightful. Thank you so much for bringing up these maps. With Cory's help, I was able to put together this presentation. It's so hard to imagine getting Lyme in states like Arizona, Nevada. As we're looking at the map, type in the chat where you're from if you haven't already, or type my state if your state is affected. And I'm
And
gonna
I
type my
should,
state in here too, because I'm from Michigan and we're affected there. So type
yeah,
in my state, Cali, thank you. If you're from California, my state. Yes, thanks, Heather.
and I'll say I'm from Oregon, and I'm in Southern Oregon, where we see some of the highest density of
Yeah.
tick-borne illnesses, Northern California and Southern Oregon. And I should also tell you, one of the reasons for this disparity as well is that the CDC still really only is looking for Borrelia burgdorferi, which is a very specific species of Borrelia. But there's a lot of species of Borrelia. There's, the relapsing fever species, and then there's a whole host of other species that we fall under the Lyme category, like Californicum and Afzelli and Gardini. And these can be in other states, but they're not going to be picked up on testing, and they're not going to be reported for that reason. But people have the same symptoms, and the treatment ultimately is going to be the same, regardless of whether you have big Darfry or not. So
Mm.
ultimately, what we're willing to do is get testing that's going to show us more accurate sensitivity for Borrelia as a genus overall, or for labs that can test a wider array. And again, I'll get further into that. I don't want to get too far ahead of myself.
Thank you. Well, yeah, before we dive into all of that, let's go to back to the basics. Let's talk about, for some of us who have never encountered a tick before, believe it or not, some of us do exist, even though it sounds like it's increasingly difficult to avoid them when going outdoors nowadays. Walk us through what to do in the event we find a tick on ourselves or on someone we know.
Yeah, I think it's increasingly rare to find people who haven't had tick bites. And of course, no one's immune to it. So if you're going outdoors, you don't want to avoid the outdoors for fear of it. You just want to be smart about it. Ultimately, the nature of removing a tick is you don't want to squeeze the tick's body. Okay. So you want to use tweezers, easy to get, easy to put in your camping kit, or you can get something more specialized like a tick twister or a tick key. But you want to grab the tick down at the base by the skin, at the head, and pull it straight out. That way, you're not actually squeezing the thorax. The risk of doing that is the tick itself is the harbor of these infections, all the variety of bacterial, viral, and protozoal infections. And so when you squeeze it, or you use something like Vaseline or a match, or people put gasoline or other things like that on it, you're actually going to cause the tick distress, and you're going to find that the tick is more likely to sounds bad, but regurgitate into you, and you're more likely to get some sort of infection from the tick by inadvertently trying to pull it off and not doing it in the right way.
Thank you for that very, very nice description. And yes, absolutely. These are some tips that we need to take with us whenever we're going outside. Let's go into a little bit more about the great imitator. I've heard this phrase before. Tell me what it means when we talk about Lyme as the great imitator.
Yeah, it's interesting because the great imitator, that moniker was originally ascribed to syphilis, right? Back in the day when it was a more predominant illness. We don't see that anymore, but Lyme is a spirochete, just like treponema. So they're similar organisms. And what it means ultimately is that Lyme affects people differently. And it highlights treatment, it highlights the need for diagnosis, and it highlights the need for more awareness amongst healthcare providers, because everyone wants to think that there are certain specific symptoms associated with Lyme, and certainly those symptoms do account for the majority of people in these symptoms, like joint swelling or redness. But ultimately, you can find, from an individualized perspective, it can present in a whole bunch of different ways. There's neuromuscular issues, there's vascular issues, there's skin or urticarial or hive-based things. It affects the GI tract in some people. And so what ends up happening is because our medical system is so fragmented and very mechanistic, you see all these different ologists. You might be ascribed to one person who's going to say, you know, we diagnosed you with fibromyalgia, or you have autoimmune markers, which are honestly pretty common to see in people with tick-borne illnesses, which we could get into for why. But so people will be diagnosed with lupus, or they'll be diagnosed with scleroderma, or you end up seeing these neurodegenerative diagnoses like Parkinson's, or myalgic encephalitis, or reflex sympathetic dystrophy, polymyalgia rheumatica. Like the list goes on and on and on. And ultimately, what these diagnoses represent is an end-stage observation of symptoms. And it's not to say that the person who's making the diagnosis is completely wrong, but they're not addressing the cause or the original reason for these issues. And people end up in this cycle of getting symptomatic treatment, which may give partial relief, but ultimately you end up in this sort of spiral of polypharmacy where you keep adding more and more medications to deal with more and more symptoms, and ultimately things progress. So this slide really just highlights that Lyme can present in a variety of different ways and affect everyone individually. Right. So Borrelia, I sort of talked about this earlier. Borrelia burgdorferi is the official CDC recognized organism for Lyme bacteria. It lives in a lot of different hosts, a lot of rodents, so mice, chipmunks, squirrels. We also, of course, know deer are the big ones, but birds is something that wasn't accounted for and may go all the way back to the original observation of Lyme, and that birds are actually one of the primary reasons for seeing the spread of Lyme throughout the country, because ticks are attaching to birds and then those birds are migrating. Lyme Borrelia is primarily transmitted by ixodes, the black-legged tick. That can be there's different versions of it across the country. But I really want to take this moment to highlight the fact that while we think of Borrelia burgdorferi, or I would say officially, as being the reason for Lyme, the truth is Borrelia as a genus, as I said, is really going to represent the combination of Lyme and tick-borne relapsing fever. Ultimately, you're going to see the same symptom presentation with almost any Borrelia infection that can come from a hard tick like the deer tick, or you can see it from dog ticks, you can see it from Lone Star ticks, or you can see it from soft-bodied ticks where you get things like Borrelia hermsii. So ultimately, Lyme can come from any Borrelia species, and it's important to know that, because when you get tested from your primary care, a lot of times, and you do that through Quest Labs or LabCorp or one of these, standard reference labs, they're only testing for Borrelia burgdorferi, the B31 lab strain, and it's one reason why we see all these false negatives, and I think that'll be on a slide coming up.
Mm-hmm.
Okay, so Borrelia is the first of the three Bs, and I kind of talked about that. Ticks are reservoirs of infection, and they carry a lot. Today, I'm really going to focus on what I call the three Bs. That is to say, there are things that I'm not talking about because we just don't have enough time. So Ehrlichia, Anaplasma, Rickettsia, Mycoplasma, Chlamydia, all bacterial species that you can get from a tick, but maybe not as common or more easily eradicated. I think there was actually one study that was done that showed that there was well over 200 potential pathogens within a tick, kind of a frightening number to know, especially considering how many we can actually test for. But the second of the two Bs is Babesia. Babesia is not a bacteria, it's a protozoa, or a single-celled parasite, and its closest relative is malaria. It, just like malaria, infects red blood cells and uses a red blood cell as a reservoir to reside in the body. In terms of where you find these, you'll find that Babesia is just like Lyme in mice and small mammals. You can see it certainly in deer as well. This is something that in areas of the country where we don't see Lyme as frequently, like say the Southeast in like whatever, Georgia or Florida or areas like that, or even in Texas, we may see higher amounts of Babesia, in fact, than even just Borrelia, because it's present in other tick species like dog ticks more commonly, or in Lone Star ticks. Even though, again, of course, Ixodes is going to be a primary carrier of all of these, and that's why it's highlighted in these slides.
Mhm.
And the third of the three Bs is Bartonella. Bartonella is another stealth bacterial pathogen that a lot of you may have heard of already. It resides in blood vessel linings and red blood cells. It tends to like those blood vessel linings. And in terms of symptoms, it often affects the tendon insertions. In Lyme, we often think of as joint pain, because Lyme is a selective anaerobe. It's an organism that doesn't really like oxygen, so it'll go into these deoxygenated regions like our joints, which is one reason we see so much joint-related symptoms in people with Lyme. Bartonella often will infect the areas around the joints. But ultimately, reservoirs for this include cats. It's a big one. This is Bartonella is cat scratch fever. So you can get it from something other than a tick bite. And in this case, and even if we again look at the CDC, there's still limited recognition that ticks are primary reservoirs of Bartonella. It's more thought of that fleas and lice and other, biting organisms are more commonly associated with transmission of Bartonella. But we know that ticks, like Ixodes and others, are definite drivers and definite contributors to Bartonella. And I love this picture because it shows the stria. A lot of people don't realize that one of the symptoms, or I shouldn't say symptoms, one of the signs of Bartonella are these like stretch marks, and we call them stria. And they often appear in areas of the body where you wouldn't traditionally see them for, periods of weight gain or weight loss. And a lot of people just dismiss these stria because of that idea that, oh, I went through a period of weight gain or sudden weight loss. Or they're in areas of our body that we don't often think of, like our low back or our upper thighs, where we're not, typically looking, or people aren't commenting. But if you're someone who's seen those sort of odd stretch marks, it can really be a big indicator of Bartonella.
Mhm. Well, all of this is really important to be educated on. Thank you so much, Cory, especially if we're new to the topic or to tick-borne illnesses. And maybe there are members in the audience today who didn't realize they had been bitten by a tick or contracted any of these three Bs. So their health is declining, they're showing these vague symptoms, but can't pinpoint the cause. And the journey through diagnosis and recovery can be beyond exhausting. Well, we have a surprise guest that I want to introduce to you today who walked a path like that one. She's persevered and found a path to healing that you're going to find inspiring. So, I have the pleasure of introducing our surprise guest, Heather Sunderland, who is going to share her personal story of how she restored her health after 22 years of suffering with undiagnosed Lyme, mold toxicity, and SIRS. By the way, and this is impressive, Heather is a board certified functional health coach who founded Health Coaching by Heather and the Navigating Mold in SIRS course for practitioners. Heather, we're so happy to have you here today.
Thank you, Kelsey. I'm so excited to be here. And I'm going to give you guys, as Dr. Cory told me earlier, the coffee shop version of my story because I was sick a very long time. So I grew up in Pennsylvania and I had two dogs and I was outdoors a lot, frequently had ticks on myself and my dogs, but never really thought much of it. By the time I was 30, I started to experience daily aches and pains along with some severe fatigue, and my pain was always moving around. I was eventually diagnosed with fibromyalgia and chronic fatigue, but the labels just kept coming and the symptoms kept getting worse. By the time I was 35, I stopped working as a dietitian because of the pain and fatigue was so intense. And then I developed just very severe daily neuropathy. I developed interstitial cystitis. I had a lot of gastric issues. I was actually homebound for 10 years. I could not tolerate the pain of riding in a vehicle. And eventually, my neuropathy was so bad, we implanted a spinal cord stimulator to block the pain to my brain, which gave me the ability to walk a little bit better and a little bit longer, but I was still really, really struggling to walk and stand. Despite all the diagnoses, no one could explain to me why I felt like my body was falling apart, and my symptom list seemed to grow over time. I struggled to really participate in daily life and to show up the way I had wanted. I could not travel to see family or to go on vacations due to the intensity of my pain. And it was really frustrating not having a name for what was going on with my body. People didn't understand, why I had a walker, why I had a wheelchair. It didn't make sense. It wasn't until I was 52 years old that I was actually finally diagnosed with chronic Lyme disease. And I did begin treatment and I chose to treat herbally and I herxed intensely and saw a huge reduction in my symptoms, but I was still not well. I still struggled to walk and stand. I still struggled to go up steps. I had severe ligament laxity. I was at the chiropractor 3 times a week. And as a result of these limitations, we moved across the country to Arizona to be in a 1-story home where when we got here, I was using a walker. I struggled to walk from the front door to my bedroom. And I actually entered health coaching school in 2019 from a zero gravity chair because I would actually go out of alignment if I sat in a regular chair just to try to figure out what was going on with me. And it was actually during COVID that my Lyme reactivated. I did not know that was possible. I really did not want to delve into getting myself super educated about Lyme. And that same month, I developed hyperthyroidism or Graves' disease, which caused me to be awake for 72 hours at a time. My heart rate was very, very elevated. Medications did nothing. And I blamed all of this on my Lyme disease. And I also had reactivated Epstein-Barr, and it was a very scary, dark season in my life, and it wasn't really that long ago. I worked with a lot of practitioners who specialized in Lyme, and we did IV ozone and 10 passes, but really nothing was shifting. And that's when I met a colleague who I think is on this call right now, who I'm very thankful to, who suggested I might be dealing with mold toxicity and chronic inflammatory response syndrome. And I'm so thankful she did. We tested and confirmed I had chronic inflammatory response syndrome. And for those who don't know what it is, it's really the toxic bucket of the body overflowing, which can happen from mycotoxins from mold or from biotoxins from Lyme and also from other toxins we're exposed to. But that caused me to remember that we had a water leak in our home in Pennsylvania. And my parents then informed me that my childhood home, my bedroom, had black mold stacky in the wall. So it all started to make sense, these issues that I had. And that when I got bit by a tick, even though I never saw that I had a rash, that my body and my immune system could not do the job to get rid of it. So it was a very difficult season. And I actually did find out I had SIBO, small intestinal bacterial overgrowth. Around that time, I started working with a practitioner who treated for Lyme mold and SIRS. And I was down to 10 foods that I could tolerate. I started treatment and nothing after 6 months of treatment had shifted in my health. Um, so I'm going to share the good part of the story for a little bit later, but I do want to tell you, I would not be here today if I had not restored my health. And I wanted to just share a little bit of how I was diagnosed with Lyme. My testing was maybe not typical to some other people's testing, but I had an ELISA and Western blot done. I did not meet classic CDC requirements for Lyme, but I did have Borrelia burgdorferi in my blood, and a holistic practitioner decided to treat herbally. And I went through, major herxing and did see huge improvement in my pain levels with doing that. And I also had a lot of kinesiology that was done that also verified when my Lyme was active and sort of alternative testing, not more the traditional testing. But I'm really excited for Dr. Cory to continue sharing about the rabbit hole of testing for Lyme disease. I know I'm going to learn from him, and I've really enjoyed learning from him thus far.
Yeah, we're going to go down the rabbit hole of testing, and I laugh a bit because I know for many of you, similar to Heather's story, and thank you, Heather, so much for just being here and for sharing that, because I'm hoping it'll really resonate with a lot of the people who are attending today, and just know that you're not alone in any of this. If your loved one is the one who's struggling and suffering, they're not alone either. Thank you for showing up and being here for them. So, Dr. Cory, there's no one better than you to explain what it is, the rabbit hole with testing. So I'm going to leave it in your hands.
Great. And yeah, let me just reflect back and say thanks for sharing that story, Heather. You really described the complexity of virtually everyone suffering from chronic illness and what I see and the Venn diagram of my own practice. The idea that we're dealing with just tick-borne illnesses, while it happens in chronic cases, it's often there's something that breaks the straw that breaks the proverbial camel's back, and that there's other things. Your body has a certain capacity for a certain inflammatory load. And so, like COVID as an example, we saw a lot of people who had been in remission for years or decades even, suddenly reappearing in my office after having gotten COVID. Or we see the same phenomena like Heather mentioned with people who've had mycotoxin exposures or other organic solvents. So ultimately, it's this interplay, a lot of times chronic infectious illness, which we're talking about today, and tick-borne illness, but environmental medicine is overlaying this. Immune dysfunction is a huge, huge portion of actually getting well and correcting that immune dysfunction. And then structure. I really love that Heather brought up this idea of hypermobility. We see a lot more of this issue, and ultimately your body, the mechanical nature of your body and how it affects everything else that I just talked about. So you don't have to have Frank Ehlers-Danlos to know that there's something else going on. But anyway, I know that this transition is on testing. So ultimately, why is Lyme so difficult to diagnose? I'll say the first thing is what I said earlier. Everyone's just looking for Borrelia burgdorferi. And when we look at a two-tiered testing, there's two parts to it. One is what's called the ELISpot, the ELISA, or the IFA, the immunofluorescent antibody, which is basically just a sort of blended up version of Lyme, and it's looking to see if your immune system reacts to it. They use what's known as the B31 lab strain for that. Ultimately, that's part of the reason why we see such poor testing, as you can see, because there's a lot of other Borrelia species, like I mentioned before, as well as the fact, and I want to go back to that other slide for a quick second. Sorry,
I'm
I
jumping the
hadn't
gun
totally
here.
finished it, but yes.
Back down the rabbit hole we go. Go ahead.
I'm going to go, and I'm just going to kind of, organically move through this. But if you got a different strain, if you got a wild strain, it may not show up positive. And then, of course, like the two-tiered criteria, the second part is that you have certain bands that are positive on a Western blot or an immunoblot. And those bands are going to be positive in some people, but often it's only for this sort of magic window of time. Generally, it doesn't happen at all in the first 30 days. And then after 6 months, we start to lose some of those bands. So unless you meet that perfect criteria of being tested within that, say, 6 week to 6 months period, a lot of people are going to be lost. Other things, of course, like formation of immune complexes, your antibodies bind to the organism, and so you may not see antibodies, the sensitivity I just discussed. And then Borrelia itself is able to exchange its own proteins. It's known as plasmids. So there's linear and circular plasmids, these little sections of DNA that bacteria have. And it's really interesting because Borrelia is by far the most complex bacteria we know of in terms of its capacity to exchange surface proteins, which is one way it can evade our own immune system. And it's one way that can affect the ability of testing to be accurate. Biofilm formation is huge. It's another thing we're going to be talking about when we discuss treatment. But Borrelia itself can shield itself in this sort of shell to evade our immune system. It's known as biofilms. Everyone's very familiar with biofilms in the dental world or like in plumbing and things like that, but it happens throughout our bodies as well. And quorum sensing is this process by which bacteria and other organisms actually converse basically or speak with each other to ensure their own survival. So you see these sort of like colony-based formations with other infections. And then of course, comorbid infections are conditions. And that was what I talked about earlier with the great imitator, the idea that you may just be dismissed completely because people are going to say, oh yeah, you have fibromyalgia, or you have chronic fatigue, or you have Parkinson's or something, or multiple sclerosis, when in fact, if your doctor was to look a little further, we might see more.
Hmm.
Yeah, now let's see that slide.
Yeah.
All right, so yeah,
No
so
problem.
because of all this, we have a problem. So traditional testing, as we know, is really, really unreliable. And um, when we look at culture positive cases, so there's nothing to argue here. We see that the two-tiered test is missing, like, conservatively, it's saying 35 to 50%. We know it even may be more than that, like close to 60%. Will get these false negative rates. And ultimately, the part that even providers aren't aware of, we're all taught, if you go and ask for a Lyme test, you get this two-tiered test. But that test that you're getting, this IFA or ELISpot, or I keep saying ELISpot, this IFA or ELISA followed by the Western blot, was only designed as a surveillance test, as a way for the CDC to track the spread of Lyme disease through the country. It was never actually intended to be clinically diagnostic. It meets those criteria, great, but there's a lot of other reasons. And the CDC itself says Lyme is a clinical diagnosis. So ultimately, there's several things. One is, if things are not explainable, it obviously means you probably want to look a little further into this, do some additional testing that's going to improve that sensitivity. And there's a whole bunch of things we can talk about and will, or do some sort of treatment intervention, whether that's an antibiotic or an herbal protocol, but something to see if you actually get some results. It shouldn't be just dismissed if there's some potential that you live in an area or you've had, you trace things back. But most people don't even remember a tick bite who have chronic Lyme. I think it's 25% of people don't even recall having a tick bite. And that can be due to nymphs and other things, but I could go on and on about this. So.
Well, I want to just switch gears really quickly because I feel like I left everybody off on a cliffhanger. Heather's here today because she's doing so much better. Heather, share with us your success story, how you healed. Give us the insider tips of what you walked and experienced.
Well, the insider tip is not to just focus on killing. That was sort of my experience. We focused on killing, killing, killing. And we did not look at the entire picture, the entire toxic bucket, pathogenic bucket. We didn't look at mold. There was so much that was missed. So, what really made a difference for me, number one, was addressing nervous system dysfunction, which often gets missed. Addressing water damage in the home. Everybody I work with who has chronic Lyme, when they find me, they're always in a water damaged home and they don't know it. And it really keeps them unwell and suppresses their immune system and adds to the toxic burden of the body and can mimic those symptoms that people with Lyme present with. Then opening drainage pathways so that when we're killing Lyme bacteria and parasites and those pathogens can leave the body and not add to symptoms. So our bowels, our lymph, our liver, and our kidneys are the biggies. There are others, but those are the biggies. A big part, probably 80% of my healing, because I was sick so long, was really nourishing my body at a cellular level, and eating foods that were very high alkaline. And my gut was really a mess when I got started with having SIBO and being down to 10 foods. So for me, having liquid shakes like worked really well because they were easy for me to absorb and digest. And the shakes were super alkaline and they were supporting my detox pathways, especially my liver. They were bringing down inflammation quickly because they were so high alkaline. And over time, eating that way can start to starve pathogens, which I didn't experience right away. I experienced later on, after about 18 months doing this, where parasites were dying and I was seeing them, in the toilet, and I wasn't taking anything to kill them, which was pretty crazy. I did have to address killing. I did have to address killing bacteria and parasites and viruses and mold. I personally did that herbally. I never took an antibiotic at all to treat my chronic Lyme. Just never crossed my mind to do that. I did work on detoxing. That was a huge piece of my healing. And I had to work on healing my gut because it was pretty messed up from living in mold my whole life and having just undiagnosed Lyme and parasites for such a long time. So it was a process. But once I found this approach, pretty much within 3 months, my brain fog had lifted. I did not need to go to a chiropractor ever again after 8 years of 3 times a week. At 6 months, I was getting rid of assistive devices and starting to be able to walk on my own. And at 23 months, my naturopathic doctor who did Lyme, mold, and SIRS said I didn't have Lyme, I didn't have mold, didn't have SIRS, didn't have Graves' disease, and pretty much I had reversed about a list of 20 illnesses. Now, at that point, at 23 months out, I wasn't sick, but I still had a lot of baggage in my system from all the years of undiagnosed being in mold. And so I still, my body for the next 2 years was continuing to release pathogens and toxins. It was a crazy journey.
Mhm.
But at this point, like I'm no longer sick. I'm hiking, I'm biking, I've re-entered the world. I'm health coaching, I'm helping other people. And my desire is really to give people hope that no matter how long you've been sick, you can restore your health. It is going to be a process. It is going to be work. But if you have the desire and the willingness, if I could do it, being sick at the age of 30 and I'm now 60, trust me, you can get there too.
Thank you so much, Heather. It's so true. Thank you for being such an inspiration to our talk today. Cory, let's talk a little bit about the treatment of Lyme, because I know everybody's path is different, but we're curious, what is the recommended, or traditional path, if you will, and give us some more insight on that, please.
Yeah, so I think it depends on where you are and the recognition point you're at. This slide is a good example of this. If you know that you've actually been bitten by a tick, you're going to want to kind of put it on the calendar. A lot of people just sort of forget the fact that they went camping, but if you develop symptoms within, say, 7 to 30 days, generally it's sort of that 10 to 21 day window. And those symptoms are generally very vague. They're more like flu-like illness. Body aching, sometimes you get fevers, sometimes you get, insomnia or fatigue, like things that are not generally like what we all think of. You want to take note of that and see a provider or actually start a protocol as quickly as possible. If the tick itself has been attached for less than 12 hours, ideally less than 6 hours, your luck is better. But the duration of the tick bite itself doesn't necessarily guarantee that you can't get an infection. And they've actually found that ticks that are attached as short as 10 minutes can actually still transmit, because ultimately, if that tick is squished or any other thing, it can, again, regurgitate into you. The bullseye rash, it's one of the things that everyone asks about. It's pretty uncommon. And when you think, you look on Google or you look in a dermatology textbook, it's always going to show you that perfect bullseye, but that's not really how it looks for most people. Aside from the fact that only 15 to 30% of cases actually have the bullseye rash, generally it probably 5% of the time looks like a bullseye. A lot of times it's just sort of a spreading red mass. And again, fewer than 50% of people recall any rash at all. So,
Here, I'll move on to the next one here. Continue, please.
yeah. So like I said before, that initial stage of infection generally starts in that sort of 7 or 10 to 21 day window from a bite, pretty vague, headaches, fatigue, feeling more moody, things like that. It doesn't happen in everyone. A lot of times, again, it could be that you're just sort of this progressive, like I feel more and more tired. Maybe it's like I'm not sleeping well. Maybe it's stress from my family. But ultimately, if things don't shift, like I tell my patients, like try and stop making excuses for why you're feeling unwell and start looking into other potential reasons. The appearance of any sort of like progressive symptom following an outdoor trip is reason to have concern. Of course, if you do get the erythema migrans or a bullseye rash, or any of these sort of systemic symptoms, you can always go on to ilads.org and look up the the standard of care treatment with antibiotics, which can be done in that first, again, you want to do it within the first 6 weeks of getting infected to ensure that you don't need to go longer than that. Of course, there's, as Heather mentioned, herbal options, both for prevention as well as for treatment to resolve these as well. It's not to say you have to do antibiotics, but it is noteworthy that there is a standard of care, and it's not going to follow what you see from, a lot of Infectious Disease Society of America sort of following the standard of care, which is like 7 to 10 days of antibiotics. I would discourage anyone from doing that. If you've ever had a tick bite and you were given that, the worst is the 1 day. If you're given 1 day of antibiotics, it's like it's criminal, honestly. But even 7 to 10 days is a problem because it doesn't fully resolve these infections. And what it really does is it blunts the antibody response. So you won't ever test positive based on those indirect antibody-based tests. Your immune system never develops a response. So what happens, and we see this a lot, is people have this story of, I got a week of antibiotics or a day, and then I was sort of okay, but at 3 months or 6 months, like everything sort of, the wheels fall off and everyone starts to feel badly. And it's because that infection was never completely resolved. And then unfortunately, like the standard of care test, these, an immunoblot, say you can skip the ELISA or the IFA, it won't be positive because that antibiotic was given in that first week. So you need to do direct like molecular testing, like again, like a digital PCR or an RNA fluoroscopy or a T-cell test, which I think is a really accessible and good test, and I can get into further as we move forward. So yeah, this really essentials of treatment, and this is a short list. Number 4 is really, reflecting on Heather's story. It's an important one. And I discussed earlier this idea of your inflammatory load, how much your body can handle. A lot of people probably do have Borrelia or other organisms that they may be functioning pretty well with and doing okay. And a lot of times you get some other thing like a mold exposure or another infection or some major emotional stressor. And that's what ultimately drives that inflammatory load up. And then the proverbial sink is overflowing and you feel terrible. But, so for the essentials of treatment, need for detox, like supporting routes of elimination, and helping the body to keep its health, right? Like whenever we deal with chronic illness, I tell my patients all the time, you're not just treating what's wrong with you, you're always needing to fix what's not right with you. And I think that's a concept that's lost on a lot of people because you don't want to always just be disease focused, as Heather mentioned, and just look at the organism. You also want to be health minded and try and focus on how you keep people well and restore their own, their own bodies to function. And that includes like immune competence. But the ultimate core fundamentals of killing is going to be the antimicrobial, right? Whether that's herbal or pharmaceutical. Immune support, things that are going to help your body to clear these infections. Your immune system is broken into your cell-mediated or innate immune system and your adaptive immune system. And a lot of times Lyme itself can shift the balance and create this sort of adaptive immune dominance. We call it a Th2 dominance, where you get a lot of inflammation, but you don't get a lot of action. So it's sort of like a lot of yelling without a lot of, actually, help that your body's doing. And so from an immune standpoint, like, again, Heather mentioned, whether it's ozone or herbs or other things, you want things that are going to drive the innate immune system, your natural killer cells, your neutrophils, your macrophages, increase the quantity, the fraction, as well as the the vigor of those cells so that they can get rid of those. And then biofilm treatment is critical. If you have chronic Lyme, you have biofilms, and ultimately Lyme itself has different morphologies. We all think of that spirochete like we've seen pictures of. but it also has forms like its colony form, we call it an L form, and those are generally what you see in these biofilms, as well as intracellular forms that can be both cystic or this sort of mysterious persister form, which is a state where the bacteria itself is able to more or less go into almost a state of hibernation to avoid your immune system and or antibiotics. And this is where a lot of times things like herbs are superior to traditional pharmaceuticals, and why ultimately some people do better with a purely natural treatment, or most people will do better with an integrative approach where you're combining the best of both worlds.
Thank you so much. Thank you. So I hope that this is resonating with everybody who's listening and watching in today. And I want to thank you so much for taking the time to participate and be part of this talk today. So grab the chat box to type in yes if you, someone you know, someone you work with has been suffering from these unexplained or worsening chronic symptoms. We've heard a lot of really insightful information. We shouldn't feel defeated because we do. We have Heather's story, for example, as a guide and inspiration. Type in yes in the chat if there are undiagnosed concerns despite seeing multiple doctors. Type yes if you have experienced the fatigue, the exercise intolerance, poor recovery, joint or body pain, brain fog, unexplained anxiety or depression. Type yes if you, someone you know, have symptoms making it just hard to function. I'm going to ask you now, are you ready for a protocol that is tailored to your needs? Are you just tired of doom scrolling for answers and want to learn from a true blue Lyme-literate doctor that we have before us today? I see lots of yeses in the chat. I love that. I'm going to ask you, Dr. Cory, with this lively audience, tell us a little bit more about what we can do for those who are struggling with a lot of the symptoms that I just talked about.
Sure. I love that term doom scrolling. Like, really, I do. It's a great word.
We all do it. We know it.
So, I'm really proud to be the Chief Scientific Officer of Zenmen. I know the founder and how sincere and determined his efforts are to be able to help everyone and offer the highest quality products. And it's one reason that I joined. Of course, as I mentioned, I'm integrative and ultimately in a naturopathic physician. I use a lot with herbs. And there's 4 products that Zenmen carries that all have the potential to really help people, either from a preventative standpoint, from a treatment challenge, from something you can use to improve testing outcomes, or even to treat with. And the core of this is going to be the tick immune support formula. It is really this beautiful formula. It's a combination of herbs that work synergistically to address every aspect of the disease, whether this is Borrelia babesia or Bartonella, because it addresses microbial persistence, immune dysfunction, biofilms, chronic inflammation, neurologic disruption, and opportunistic viral or fungal organisms. And a lot of you, if you guys have been doom scrolling, you probably have read some of these herbs individually, but the combination is rarely put together into one formula, and this is a well-done one. So Japanese knotweed, cat's claw, Chinese skullcap, cryptolepis, cistus, wormwood, alcornia, sarsaparilla, the biofilm agent, serrapeptase, and then of course bioperine to improve absorption. The second product, monolaurin complex, synergizes extraordinarily well with the tick immune complex. It offers as well additional antimicrobial effects, including viral and fungal. It increases the biofilm disruption. It reduces antibiotic resistance for people who are trying to do more of a integrative approach. It increases white blood cell activity and reduces pro-inflammatory cytokines. So it addresses that immune component, and it helps to manage Herxheimer or die-off reactions by helping to clear endotoxin or bacterial debris like dead stuff from killing these organisms. It's this great combination of monolaurin, astragalus, beta-glucan, which is the primary immune driver you'll find from mushrooms like reishi, for example, or maitake, a little bit of cat's claw, and olive leaf. And so these opportunistic infections and the additional antimicrobial component it adds is great. The third thing is green and black walnut hull extract. There was a great paper that was released. It's actually been done a few times looking at different herbs and their effectiveness against treating Borrelia. And then that went on to look even further at Bartonella and Babesia. And black walnut hull, green black walnut hull extract has been shown to be one of these that's incredibly helpful. It disrupts bacterial membranes and inhibits enzymes that are critical for the survival of all of these organisms. The tannins and ellagic acid that you'll find are useful in calming the immune response that you'll find people like experiencing joint pain or systemic inflammation. And it inhibits biofilm formation from Borrelia. We know there's some actually cool research on this. And then the last one is the garlic bulb extract. I'm sure you've all been told from your grandparents on that, you want garlic is good for you. And it turns out that we're all right. Garlic is something that we all think of as culinary, but it has this incredible medicinal quality to it. And when you use it as a strong 1-to-5 ratio garlic extract, like you get from Zenmen, you get this actual medicinal effect where it can, again, disrupt bacterial membranes, inhibit enzymes. It addresses both the spirochetal as well as those dormant persister forms of Lyme. Again, you'll find that in the research studies. And I think it was really cool to note that allicin, the active ingredient in garlic, has stronger activity than doxycycline and cefuroximine against persister cells of Lyme, these ones that evade conventional antibiotics. It calms down inflammation, it improves endotoxin, and ultimately it degrades biofilms. So it's a great product.
Thank you so much. And I just wanted to recall with everybody, or maybe you joined us a little bit later, we're not here to give you a magic bullet pill that will solve all of your problems. These are natural supplements that are professional grade. They should be part of a holistic plan. And I'm going to pass it on to you, Cory. Let's talk about the different protocol options. And then after that, I'm going to give the audience a special gift. So let's talk about protocol first.
Sure. Yeah. So these 4 products lend themselves well to different protocols. And as Kelsey mentioned, there's no magic bullet here. There's no guarantee on anything, but that's life, right? And these products do lend themselves well to different applications. So the first one is just prevention. If you're going to be going out into the woods, you're going to be camping. It's a great idea to protect yourself these days because you never know what could happen from a tick bite. So I generally recommend if you're going to head outdoors that you want to start with the tick immune complex. It's the perfect, like I mentioned, blend of herbs. You would want to take 3 capsules twice a day during your trip, ideally starting a day before or earlier if you want, to help protect against tick-borne bacteria, viruses, and other things. And it also can give you some additional support against, things you might catch from people who are joining you on your camping trip. So it's great. The second protocol is a post-tick bite protocol. This is something that you heard me mention you really want to do within the first 6 weeks of a bite at the longest. If you go past 6 weeks, you're going to be probably a little bit in a different category. But it was designed to provide the best antimicrobial and immune protection following a tick bite. And so it involves the 3 products that are all focused primarily on the killing of things and the elimination of potential infections. It's tick immune complex that you want to take 3 capsules 3 times a day. So you're using very high doses of it. Black walnut extract, you would use 2 dropperfuls 3 times a day. And you would do garlic bulb extract, ideally 2 dropperfuls 3 times a day as well. And you're seeing these sort of higher doses with this protocol because you want to give yourself the best opportunity to ensure that you do clear these infections before they can establish themselves, create biofilms, and create this sort of chronicity. You want to stick with this combo for 4 to 6 weeks at least. So it's not going to take forever, but you want to do the high doses for at least a month and a half. It's easy to remember. Take it within the first 4 to 6 weeks and use it for 4 to 6 weeks. Okay. The third protocol is what I call a symptom trial or a pre-testing protocol. And this protocol is ultimately designed to deal with people who are suffering with lingering or chronic symptoms, or for people who are preparing to do immune-based testing. That could be an immunoblot or a Western blot, like we talked about, or it could be a T cell based test, like an ELISpot, also known as a lymphocyte proliferation test, something that'd be fun to go further into with you guys. But it's a great test. You can get them done. Armin Labs, for example, in Germany, you can self-order a lot of those. And I think we may in the future have those opportunities for people to order directly. But this treatment is designed to either see if you notice improvement in your symptoms, which can be a huge clue that like this is an issue, or again, something you can do and improve the outcomes of your testing so you're more likely to get an accurate result and diagnosis from your provider. And it only involves two things. The primary tick immune complex, of course, for all of that it offers, and it's only 3 capsules twice a day, as well as the monolaurin complex, because you want something that's going to aid, especially in addressing those biofilms in the immune side of things. So this is great. And with the monolaurin complex, you would take 2 capsules twice a day as well. So 3 capsules twice a day of tick immune, 2 capsules twice a day of monolaurin complex. And you'd want to use that for around 6 to 8 weeks to see if you, get, well, what you could get is you could in the first couple of weeks get a little bit, you've heard the term die off, and something, again, many of you may be already familiar with, but you might notice an actual worsening of your symptoms in the first 2 to 4 weeks. And then often people will experience a gradual improvement or shift. And that's a huge clue. And then the fourth and last protocol that was made is really the symptom relief or chronic Lyme support protocol. It was a protocol that I developed to provide comprehensive support for people with either suspected or confirmed tick-borne illnesses. Sort of like what Heather talked about, it's a full protocol that you can use for really 4 to 6 months to try and actually, bring yourself towards a place of health. It is designed to be as complete as possible in addressing antimicrobial, biofilm, immune, detox, and die-off/inflammatory concerns. So with all 4 things, the tick immune complex, high doses, 3 capsules 3 times a day. I can't emphasize how important it is to really take these higher doses. People, aren't always aren't always aware that herbs are medications, and you need to make sure you're taking them in the right doses to get the effects you want. So again, dose matters. So 3 capsules 3 times a day of tick immune complex, 2 capsules twice a day of the monolaurin complex, 2 dropperfuls 3 times per day, ideally, of black walnut extract, and 2 dropperfuls 3 times a day, ideally, of garlic bulb extract. And again, you want to do this for really 4 to 6 months to allow time to reduce inflammation, dismantle biofilms, restore immune function, and ultimately clear these infections as much as you can.
Thank you so much. And you know what? Dr. Cory has been instrumental when working with us at Zenmen to design these series of protocols that are meant to support every level that we've covered today. If you don't have it written on the back of your hand like Dr. Cory does, don't worry. If you purchase one of the bundles from us, you will get a protocol guide that has it all laid out in a nice, clean PDF format. So that way it's all structured and written out for you. Plus, you can use it as your daily supplement checklist. Guess what? We are so grateful that you chose to sit with us for the evening on a Friday, late afternoon evening, no less. And one of the many special gifts you're about to open up with me is a raffle to win a free 30-minute session with Dr. Cory so he can give you some practical coaching on your health journey. If this is something that really piques your interest, type me in the chat if you want to be part of this fun raffle right now. There we go. They're coming in. At first, I thought my internet was slow. Here we are. We're looking at a lot of me's in the chat, a lot of names. So our admin team is going to be selecting a name at random. Go ahead, Michelle, go ahead and type in the name of a winner once you've selected one at random. Thank you, thank you. If you want to add a me to this, if you haven't yet, there's still time. All right. Michelle's really being judicious and picking a name at random here. Okay. You know what? We'll come back to it. We're going to leave everyone hanging. Oh, there we go. Thank you so much, Michelle. Marilyn, thank you. Thank you to you as well, Anne and Krista. Thank you, Igal, for participating. It looks like we have our winner. Marilyn, you are just won a free 30-minute session with Dr. Cory. Thank you so much. Thank you to everyone listening today, but don't go just quite yet. We truly appreciate you. If your name wasn't called, don't be bummed. We've got another offer for you. Our expert guest speakers, Dr. Cory and Heather, have opened up their calendars to work with more of you. So listen closely and hear the incredible packages we've put together for you. So exclusively yours, we're offering a foundational support package that includes one-on-one time with Heather, who will give you the time and space to share your journey so far, and then she'll provide you with the insider details on how to navigate the tricky terrain of treating Lyme disease or a tick-borne illness. So you'll get a 30-minute discovery call plus a full 60-minute session to get personalized attention and support. Included in this package is the Zenmen professional grade tick immune support bundle that Dr. Cory just previewed to all of you. It includes all of the supplements that were listed out there, the tick immune support capsules, the monolaurin, black walnut tincture, the garlic tincture. There's more coming for you if you choose this package. So if you look at the list on your screen, we're throwing in some bonus materials to give you more science-backed information and tools to keep track of everything. So that means you're going to get from Heather her mold toxicity checklist and next steps guide. You'll also get the Zenmen herb guide that comprehensively describes each of the components of your supplement bundle. You'll receive a handy symptom tracker that can be used daily, weekly, monthly, and my personal favorite, you'll get access to our protocol guide, which is broken down into the 4 protocols described earlier by Dr. Cory. So normally the cost of this is $523, but given that we're offering great deals for this masterclass, you can get it at the low, low price of $249, or for just $75 more, if you feel for it, you can upgrade your time with Heather and invest in the targeted treatment package. And this gives you a 90-minute deep dive plus the initial 30-minute discovery call with Heather. Everything else is included: the Zenmen tick immune support supplements, all the bonus guides, the trackers, the protocols, etc. That one is normally priced around $600, but you can get it for nearly half off at $324. Again, these are not normal prices. We do not sell these supplements at this low cost. Heather is giving time away to support you as a beloved audience guest. But where's Dr. Cory in all of this? Time with him is limited, and thus we can only offer a limited number of this next package. Work directly with Dr. Cory on improving your treatment plan. Get connected with the right people and support system. Get insights on what you're currently doing well versus what needs to change. And you'll get a chance to work with a Lyme-literate doctor. Can I get an amen in the room for that? Which many of you know, this is imperative to your health journey. So Dr. Cory's rates are typically hovering $600 per hour for existing clients. The price is increasing as his availability is decreasing. He's on demand, guys. So he's currently booked out until October because he's in such high demand. There's good news for you. The good news is that you can work with him at this incredibly low price of $399. The even better news is that he's opening up sooner slots, so you don't have to wait till October. You can get in with him in the next weeks or in the next month or so before the holiday breaks. So guys, you have to take advantage of this. The unfortunate news is because he has such limited time, we only have 3 slots open. We had 4, we gave one away. You're welcome, Marilyn. We have 3 more open. I'm gonna have Michelle drop the link in the chat now. If you're interested in purchasing this plan with Dr. Cory and one of the earlier plans to work with Heather in either the deep dive or the foundational package, this is your moment right now to check it out. If you check the the link in the chat, you'll see that that's where you can go to get more information about what these packages contain, more information about the supplements themselves, if you wanted to just look more closely at the ingredients or possibly the protocols. Please do check out that landing page link if this is something that you want. We are not offering these deals for long. They are exclusive to you, meaning this isn't something that we're blasting to the internets. It's for you for taking the time out of your day to join us. It shows that you're interested. If you're ready for support, if you have a loved one that you know could use the support, I encourage you to check it out and purchase it today. And I promised you all that there would be a Q&A, so put your questions together. We're going to pause a second. If you have a question, write it down in the chat box. We're happy to answer any of the questions that you have. Dr. Cory is going to hang on the line. Heather is still here. So if you have questions specific for them, please feel free to direct your question to them. If you have questions about the packages or the supplements, we can assist you with that as well. And yeah, again, we're so glad that you're here today. We hope that you'll get a chance to work with Heather or Dr. Cory. Anything to add to that, Dr. Cory? I want to just thank you so much for being here. Heather, if she's still here. Thank you for sticking around, guys. We're so grateful that you're taking time out of your day, sharing what I think is a really insightful masterclass. Anything do you want to add to that?
I'm
putting you on the spot.
I would say you're a great moderator, Kelsey. So let's give some recognition to you as well. But it's been a lot of fun. I really enjoy what I do. Appreciate the ability to help solve puzzles with, all the complex people that I see. And it was a privilege for me to be able to take this last hour to go over all these things and hopefully give some education and some perspective on the challenges of those suffering from chronic inflammatory and chronic illness, and that under recognition of it, and to let you all know that there is a path towards help. It was great to have Heather on, that you guys could all hear that really people do get well, you can get better, and to not give up.
Yeah, I really appreciate you mentioning that and wrapping it up. The hope is so important. That emotional piece is an integral in someone's healing journey. I'm seeing some questions pop in. Let's just dive right in.
I'm
So,
going to jump in from the top with Eagle.
yeah, go ahead. Please do.
I had stroke symptoms from tick immune support product when I took his instructed doses and less than instructed. Any thoughts? I hope for the best, but didn't do well. Well, I would say that it's probably worth looking into other potential issues, Eagle. I don't think ultimately, as a matter of fact, I can tell you that none of the herbs in that tick immune support pose direct risk or have the recognition of causing, either a clot or rupture of an aneurysm that would be associated with a stroke or anything like that. So it could be one of two things. One is it's possible that ultimately you did have, or you do have, an underlying tick-borne illness. And as Heather had mentioned, you were experiencing an inflammatory event from the killing of those organisms. Anyone who actually ends up feeling, I should say, overloaded with inflammation or having symptoms, it's never a bad idea to reduce your dose and then gradually increase as you become more tolerant. It also may be that you'd want to add some of the other agents in to improve the antimicrobial effects, or again, that you'd want to work with a Lyme-literate provider to help your body deal with the inflammation overall that you may have experienced. But again, as a healthcare provider, I don't want to just say, oh, it was die off. Like, maybe it was something more concerning, and it may be something that you want to make sure was investigated. There's a lot of labs. And so, the part that we didn't fully cover today is like when you work with a provider, yes, you're going to be doing testing around tick-borne illnesses, but it's not to say there aren't other things that you want to look at. So looking at inflammatory markers, looking at autoimmune markers, looking at other, potential things from thyroid and biotoxin and, things that you want to make sure are getting ruled out, even imaging. So hopefully I'm answering your question, Eagle. Next question, Marilyn Burnell, preferred probiotics, fermented food, or supplements. So I don't totally understand your question, Marilyn, but probiotics, I think that there's two ways to look at probiotics. One is like you're looking for something that's designed to provide generalized support, either for your health or and more specifically for people taking antibiotics. In which case, you know, you want a broad spectrum probiotic, something that's going to offer a wide array. The second aspect of probiotics is if you're dealing with a specific scenario, like again, Heather mentioned SIBO, or maybe you're dealing with H. pylori, or maybe you're dealing with some, you know, autoimmune phenomena, in which case the concept of keystone species, or this idea that certain probiotics are beneficial for certain conditions because they, you know, help to clear candida or clostridia, or they help to clear bacteria from, you know, like helicobacter or other things. So again, like it's kind of individualized. Fermented foods are great in general, unless you have a histamine response. Like we didn't talk about things like mast cell activation, but ultimately, you know, because fermented foods are very high sources of histamine. But if you do well on fermented foods, then great, it's a good idea. Supplements in general, the supplement market is it's the Wild West for sure. There's not really any CDC oversight on any of that. So it's important to know that cost and value are not always the same thing. And so you want to work with a company that is, you know, going to be professional grade. As Kelsey has mentioned, a lot of times you want to not always go with the lowest cost version. There was a Consumer Reports at one point that was done, I think about 10 years ago, maybe, where they actually looked at different herbal supplements from some of the major, you know, retailers in the Pacific Northeast, not Pacific, the Northeast. And what they found was, you know, like you could claim that you had saw palmetto in something, but it doesn't mean that you're using the right part of the plant. And like, so you could use like the stalk of the plant and still call it saw palmetto, or, you know, there's excipients in it. So it's just really important that whatever product you choose is a reliable company. Again, why I work with Zenmen, but of course, in my medical practice, I use an array of different companies depending on what needs to be used. Okay. Yeah, you go. I got, yeah, that sounds, I would say like we could talk offline at a different time, or I would again look for maybe talking to a provider, but ultimately, you know, maybe testing would be a good thing, even tick-borne testing, so that there's some confidence that what you're doing is the right thing. Bobby, thank you. It was really thoughtful of you. Let's see, Pierre, did you hear about this? Oh yeah, so for sure, piperacillin. Yeah, I mean, of course I've heard of piperacillin. It's a big topic right now. It looks promising. The biggest challenge right now with piperacillin is you do have to administer it A, intravenously, and B, you have to do it 4 times a day. So it's a 100 milligram dose 4 times a day. And really, I don't know anyone doing it quite yet. There might be a point in the future where certain people would qualify for getting like a PICC line or a indwelling catheter, and then you can use these like elastomeric balls that you can take home with you, because it's not real practical to think that any outpatient clinic is going to be able to administer any antibiotic 4 times a day. But again, it highlights the fact that, you know, some people do better with antibiotics. Let's see. Negative to all other medical imaging. Okay, yeah, you got, well, you know, maybe you did have a die-off experience for sure. Maryland, Candida. Oh, you're talking about for the probiotic species. Lactobacillus rhamnosus, really the big Candida, you know, one, and can really help. If you're not using antifungals, Saccharomyces boulardii can also be helpful. It helps to sort of crowd out the Candida. So hopefully that gives you some help. Let's see, I'll let someone else answer your question, Pierre. Let's see, Tracy, you have active Lyme and Bartonella. Should I take 3 capsules of Zenmen, tick immune support 3 times a day? And when should I take it? Yeah, definitely. I would look at using the full chronic tick-borne illness or chronic Lyme protocol where you're doing all four things, Tracy. And again, those doses are consistent with what I would use with any of my patients. If you have any concerns or doubts, you can always start slow. You can always, like, the nice thing about herbs is we don't see, while dose matters, as you heard me talk about earlier, we don't see resistance happening to herbs like we do with antibiotics. A lot of the idea of like starting really too low of a dose with antibiotics, you run into this risk of potentially developing bacterial resistance because you're not using it at a dose that's high enough. We don't see that with herbs. So the advantage of that is ultimately, if there's any hesitancy or concern, you can start everything lower. You can start at 1 capsule and know, hey, after 2 to 3 days, I'm doing fine, then go to 2 capsules, or do the same thing with the tinctures. And that gives people a little more confidence. And ultimately, as I talked about with Eagle, if you do get a point of die off or like excessive inflammation from the killing, you can either slow things down, you can try and tolerate it, or ultimately you can do things that will reduce inflammation and help your body to eliminate more effectively so that you can tolerate that better.
And I wanted to pop in here. So as you're kind of scrolling through those questions, so I know we zipped through the protocols pretty quickly. Rest assured, if you purchase any of these packages today, you will get that protocol. If you're still interested, I'm happy to send it to you by email. In fact, I'll pop it into the email that's going to go out to you just following this webinar. So that way, if the protocol is something that you're really keen on to get started in any of our protocols here, the Zenmen bundles, for example, we can add that to an email going out following this webinar. It's much love to all of you. And go ahead, Cory, did you find another question you wanted to respond
Oh,
to?
I was just gonna say hi, Adriana. Like, thanks for shouting
I'm
out for
hearing
sure.
lots of thanks. Thank you from Krista,
Yeah, it's
Erica.
fun to see everyone out
Thank
here.
you. It looks like
Yeah,
Adriana knows you somehow. Dr. Cory is my son's doctor. Oh, thank you so much. I'll let you continue reading. We've had several physicians. We talked about the journey to find the right doctor, and sometimes it's about that, finding that right relationship. Maybe in this area though, it's about finding the Lyme literate doctor that can speak not only your language, but the language of what you're experiencing.
100%. Like, it's critical that you not give up. A lot of the people that I see have seen 5, 10, 15 other providers. Ultimately, persistence and knowing that you can get well and not giving up is key to anyone dealing with chronic illness. And finding the right person. I tell everyone, I offer like free 15-minute consults for people. And I do that because I think it's really important that you have a good relationship with your provider, that you feel good about being able to describe what's going on and that they're listening to you, but also that your provider feels like they can even help you, right? Like, you don't want to end up like paying for a whole bunch of sessions for someone who's going to, where you'd be better off seeing someone else. So I tell people, interview whoever whoever it is that you may schedule with. If ideally they should be able to give you a little bit of their time so that at least they can tell you whether they'll help you, and at least whether whether you would connect with them.
Exactly. Yeah. And so, we have these one-to-ones coming up. We wanted to make it at a really discounted price for you. We have the discovery call with Heather just to get your feet wet, to understand. She wants to hear your experience. So even if you don't get a chance to work with Dr. Cory today, if we're sold out of those quickly, remember we only have 3 spots left. Book a session with Heather. She's somebody who has walked a journey similar to yours. She knows the struggle. She's definitely been educated in a lot of what you might be going through. So she's speaking the same language. And sometimes we just need a guardian angel. If the brain fog is setting in, if it's too hard to think straight, let alone keep track of your symptoms and know how to ask the right questions and know how to do the follow-up, Heather is the guide. And that is something that she's specialized in doing, is coaching individuals like you who might be struggling with chronic Lyme, who might be struggling with discovering whether or not you have Lyme. So just wanted to pitch our wonderful practitioners here today. That way you can get a chance to work with them one-to-one. It's a rare opportunity. And if we could, as we're wrapping up, maybe just pop the landing page link in one more time. So if you're on your way out, we just want to appreciate you for your time. Grab the link on your way out. That way you can take a look at our offerings at your leisure. Know that it's not going to last forever. I think we've got this sale going on for 48 hours. There's a countdown timer at the top of the landing page. It's for real. So, so pay attention to that if you're really interested in working with us. Oh, there's a question about a replay. Wendy, at this time, we're not offering a replay, but I will get back to you. We'll be corresponding via email. So you'll get an email from Zenmen if we're able to put it up. But at this time, thank you for joining. I'm sorry that you were a little bit late. I know life takes over. At this time, though, it doesn't appear that we're having a replay. I'll let you know otherwise. Yeah, Tracy, just to answer your question. Igal, thank you so much for your participation, and I hope you do well in your health journey. Thank you to everybody. Any other last questions? Heather's still sticking around. Dr. Cory is here. Thanks, Igal. Last call for questions. Last call to grab the link in the chat if you have a second. Thank you all so much. So this wraps it up. I want to thank you for taking the time out of your Friday evening now. The clock is ticking. All of you be well. We will be in touch and have a great weekend ahead. Thank you. Thank you. Bye, Cory. Bye, Heather. Thanks again. Much love.
Bye.
Thank you. Have a great weekend. Bye, Marilyn. Thank you. Bye, Pam. Have a great weekend. Bye, Cheryl.